Hello, and welcome to Better Man Clinics, the podcast where we talk to actual experts to address the questions that men want answered, but are either too embarrassed to ask or simply don't know who to ask. Before we get started, I do want to caution that the conversations on this podcast are for informational purposes only. They don't represent a medical consultation, nor do they present medical advice to individuals. Rather, we hope that the podcast empowers men with the knowledge and confidence to address these issues with their healthcare providers. As with any medical or wellness issues, you should always consult with your healthcare provider before beginning any type of treatment or preventative intervention. With that being said, in this episode, we discuss shockwave therapy for erectile dysfunction. Historically, erectile dysfunction, or ED, has been treated with medications like Viagra or Cialis, injections, vacuum pumps, and implants. These treatments don't actually cure ED, but rather provide erections on demand. Recently, however, novel treatments have begun to appear that attempt to not only help provide erections, but to treat the underlying issues causing the ED. One such treatment is shockwave therapy, sometimes known by the brand name Gainswave. So how does shockwave treatment work? How's the procedure performed? What are the risks and benefits? What is the recovery like? And of course, how effective is it? To help us answer these questions, we are joined by a urologist with extensive experience with shockwave treatments for ED. Dr. David Schusterman is a urologist in private practice in New York City. Dr. Schusterman graduated from medical school at the State University of New York at Stony Brook and then completed his residency training at the Robert Wood Johnson Medical School in New Jersey. Dr. Schusterman was an early adopter of shockwave therapy and has now had years of experience in utilizing the procedure for the treatment of ED in his patients. In our discussion, Dr. Schusterman provided a candid and very practical introduction to this novel approach to treating ED. Now, in past episodes, we spoke to Dr. Masterson from the University of Miami about the experimental data reported about shockwave therapy for ED. In this interview, in contrast, we discussed the experience of one urologist in actually providing shockwave therapy to his patients in his clinical practice. Understanding that this is the experience of a single urologist, we're hoping to give you guys a glimpse into the practical real-world use of this novel treatment. Of course, that being said, we hope you understand that the experiences of his patients may not apply to all patients. And now, without further ado, I bring you our conversation with Dr. David Schusterman about shockwave therapy for the treatment of erectile dysfunction.
Excellent.
Hello, and welcome to Better Man Clinics. Today, we're going to be talking about Gainswave, a novel new treatment for the treatment of erectile dysfunction in men. Now, for most men with erectile dysfunction, the solution is pretty simple. They can take Viagra or Cialis and usually resolve the problem. But what if those medications don't work? Or what if these guys have other medical conditions that prevent them from taking it? Or have had bad reactions to the medication, or take other medications that interact with it? Well, in prior episodes, we talked about options for men like that, including things like penile injections and penile implants. So where does Gainswave fit in? What are the side effects? What are the risks and benefits? How does it compare to other treatment options? Is it just for on-demand erections, or is it kind of a more therapeutic approach? And of course, overall, how well does it work? Fortunately, to answer these and many other questions, we are joined today by a true expert, Dr. David Schusterman, who is not only a board-certified urologist, but also an expert on Gainswave. Dr. Schusterman, welcome to the program.
Thank you very much for having me.
Appreciate it. And as I mentioned to you before, this Gainswave is a topic that has been up many times in our chats after episodes have been published. So definitely something that's been eagerly anticipated. But before we dive into Gainswave itself, one thing I like to do before we start these episodes is to learn a little bit more about our expert. And specifically, maybe you can share a little bit about what inspired you to become a urologist and specifically an expert in male sexual health.
Well, when I was getting into the field of urology as a medical student, I realized how just amazing the technology has become in the field of urology. I mean, robotics was coming out, so now we have like robotic surgery on the pelvic area. That we had telescopes that were way more advanced, where we can see into the bladder without any problems. We could see up into the kidneys. We could treat kidney stones with just lasers, and just all kinds of cool things, including minimally invasive kidney stone treatments. So, just everything in urology has just been revolutionized by technology. So, that's kind of where my field of interest is kind of high tech medicine. I
Hmm.
like kind of evaluating people with like ultrasounds, blood work, urine testing, and all that is, kind of one of the mainstays of urology treatment. If I mean, not every urologist is a high tech urologist like myself, but
Hmm.
I feel like it's getting there. I mean, when I first got in the field, it was very little technology, and now it's just getting way and more advanced in almost every aspect of urology. So, very exciting time to be alive. Very exciting time to be a urologist. So,
And you get to play with a
I'm
lot of
happy I
cool
chose this.
toys.
Yeah, we get a lot of cool toys. We and a lot of our patients do very well, and that's really the
Mhm.
key. When you have something that is minimally invasive that doesn't harm people, but then people have amazing results. I mean, you feel good about yourself, and you feel good about your kind of field and your technology. So,
Makes sense. Makes sense. That's a
and
perfect
this is
segue.
this is
Mhm.
right in line with the shockwave therapy, which, I mean, you call it Gainswave, I call mine erection wave, which are synonymous. They're pretty much the same.
Mhm.
Erection wave, I think, was invented by a anesthesiologist for
Mhm.
more of, kind of primary care doc type environment.
Mhm.
Erection wave is kind of a little more advanced, I think, and we just cover a little more, just more anatomy, and we set it to higher settings just to improve the efficacy of what they term Gainswave. But
Mhm.
I partner with Gainswave for marketing purposes because I find that Gainswave does a great job marketing it to the
Mhm.
community. And
Mhm.
I'm a urologist, and we're not as good at marketing it to the community. Like people are finding out about it mainly through Gainswave and other sources. But
Mhm.
I feel like Erection Wave is my similar kind of technology that follows in the same footsteps. But I think we came out with it kind of at the same time. I'm less into the marketing of one field. They're more
Mhm.
into the marketing of just this erection field.
No, that's a good point. I mean, you mentioned, if you take a step back, it's really all comes down to shockwave therapy. Some guys might be familiar with shockwave therapy for kidney stones, but are a little taken aback by wait, it's for erections too. Okay, for the guys that don't have any knowledge or understanding of shockwave therapy, can you explain kind of the idea behind how this might work and help erectile dysfunction?
Absolutely. So this is kind of right up my alley with the technology front. The technology actually was invented to increase vascular flow to various parts of the body, and actually, it's FDA approved for that purpose to increase
Mhm.
vascularity to areas of injury and to other places that need extravascular kind of support. I've been doing it also for people who have tendonitis and plantar fasciitis and things like that, where you can actually improve the amount of kind of like healing that goes on there by simply just doing shockwave therapy to that area, and it helps
Mhm.
kind of with the healing process, helps bring blood flow to the area, which helps with the healing. So there's a lot of cool technologies that it's used for all around the body. But when it
Mhm.
comes to the penis, remember the penis only has three components, for lay people. I mean, there's a connective tissue as well, but the
Mhm.
main components that work are nerves, arteries, and veins. I mean, those are the three, right?
Mhm.
So if you have those three components working, they enhance your erections, right? So, I
Mhm.
mean, I could get more granular, but the essence of it is that shockwave therapy opens up your arteries, your veins, and it sensitizes your nerves so that the nerves work better. So,
Mhm.
the main effect is on vascularity, but then by the sound wave technology, it actually affects the nerves as well, makes the nerves a little more sensitized, which helps
Mhm.
with, of course, the sensation during an erection, which helps with maintaining and getting an erection. And I feel that it's a very natural way to do it because it doesn't harm the tissues. There's no long-term, kind of sequelae from having it done. It doesn't cause any like vascular injuries, but it does improve how the arteries and veins work. A lot of the times, I like to think about it as we're actually inducing the endothelium to produce more nitric oxide, plus any, like say you have a little bit of plaque that starts building. What happens if we shake that plaque off before it actually solidifies and becomes harder to treat? So, as you get older, your arteries and veins degenerate and go down. And what ends up happening is your veins that make up your erection go down in size, which is why a lot of older men describe losing size of their erection, and it's not, I mean, it's a real thing. And it's the way it's mediated is, a lot of people get, and you could even see it happening is when you have like a stenotic vein and it clots off, you could even have pain in those veins. They can have an infection there and create some pain. And you see them actually going away with time, because even the superficial veins on the penis sometimes get clogged off and actually just degenerate. And then some of the veins that you see on your penis since you were younger are not there anymore because they've kind of died out. And the veins are critical in terms of your erection is your veins, actually. What you're looking at as an erection is your distended, dilated veins. And when the erection happens, it pushes on the veins that cause the drainage of the penis. And when those veins are pushed on, the drainage gets decreased to the point where it becomes an erection, and the drainage stops at some point, and that maintains the erections. And what happens is if you lose the size and you lose the amount of veins, they don't actually congest the system enough to maintain your erection. So you can get an erection, but you could lose it very easily, and it gets soft very easily, mainly because the veins are down. And so there's a kind of the shockwave therapy helps with kind of dilating those veins and making them bigger. And there's another technology that I add on it that is called the P shot, or Priapus shot, that actually promotes the growth of the veins in the penis. As an addition, a gentleman by the name of Tom Lu, who's famous for actually inventing Viagra, did research on shockwave therapy and found that men, but not men, but rats, after shockwave therapy, there's more stem cells that come into the penis after shockwave therapy. Obviously, we couldn't do it in humans because of the issues with, we would need to sacrifice the rat to actually look inside the penis. And when you actually look in the penis of a rat that's been sacrificed after shockwave, you find that their stem cells are much higher than in the rats who have not been exposed to shockwave therapy. So it's analogous probably to what's going on in humans, where we would do the shockwave and the P shot together, and I find that it works amazingly well together because one potentates the effect of the other.
Got it. And so, okay, so, if we go to the basics, okay, it increases blood flow. It helps with kind of the veins open up a bit, kind of similar to what guys hear Viagra does. So Viagra is kind of, you take it on demand to have an erection. Is it the same thing for the shockwave treatment, or is that a different idea there?
It's a very different idea. So the way that Viagra works is simply by not allowing the breakdown of cyclic GMP. Cyclic GMP is a chemical in your penis that is related to nitric oxide kind of, getting out to the cells. Cyclic GMP goes up, creates an erection. And then there's a enzyme in your penis that actually breaks down that cyclic GMP. Now picture, instead of breaking it down, that enzyme gets kind of lowered in terms of effectiveness in the body. So that leaves a higher cyclic GMP in your cells for a longer time. So basically, Viagra blocks that enzyme that lowers your cyclic GMP. That's way further down on the food pyramid. So what happens is that Viagra and this treatment do not block each other, and they actually potenate each other, because this treatment works on more of the nitric oxide component and just get the blood there. Viagra works on actually keeping the blood there. So, I oftentimes tell people that, Viagra still works well and actually works much better after this treatment, because this dilates them before it gets to the stage of Viagra, where Viagra just keeps them dilated. And that's the whole point. Viagra just makes sure that you got continuous blood flow to the penis. This makes sure that the veins are expanded, and that they
Hmm.
block from losing your erection as well. So it kind of works together with Viagra. It doesn't actually, so this treatment in guys that don't need Viagra will help them get great erections.
Hmm.
In guys that need Viagra, uh, a lot of times they don't need the Viagra after the treatment. In
Hmm.
guys where Viagra is kind of failing or kind of not working as well,
Hmm.
Viagra now works well with the treatment. So it kind of just ups the game of Viagra. If you don't need Viagra before, you don't need it after. If you
Right.
needed Viagra before and it works great, then this will work, probably replace the Viagra doing the shockwave therapy,
Hmm.
but much more naturally, because you're actually kind of improving how your penis works. And that's
Got it.
really the key. Is how do we get your penis to work better, and naturally too, not just with medicine. And so that's what a
Hmm.
lot of patients like. The difference though is that it costs somewhat more than Viagra now, especially now that Viagra's gone generic. With generic Viagra, you could get Viagra pretty cheaply. Shockwave, you still have to pay for, and I mean, although it's not crazy expensive, that's really the main risk factor. If someone says to me, like, what's the risk factors of this?
Hmm.
Um, the amazing thing is that I was the first one in New York to start doing the shockwave therapy back in 2017,
Hmm.
and no one else was doing it. I was the first one, and I was taking a risk, but it was a calculated risk because I was the first patient to do it on myself.
Oh,
Anything
wow.
anything I do, I try on myself first, make sure it works. And I got to tell you, I didn't have erectile dysfunction, but it just I mean, you could tell that it just made things work better. I mean, so
Right.
men understand what I mean, that it just works better.
Hmm.
And it lasts longer, it's stronger, it's harder. And I mean, this is with someone like me who wasn't having, I wasn't even taking Viagra at that point, but I
Hmm.
felt like it gave me a very big boost in all the field, kind of the sensitivity, the size, the strength of the erection. And, so I felt it personally myself as someone who was not a believer when I first started.
Right. And just so the guys understand from a logistics standpoint. So again, Viagra you take or Cialis, whatever, you take a few hours before you want to have sexual activity. Is this the similar on-demand thing, or this is kind of like you do the treatment and then you're good to go indefinitely, basically?
Correct, correct. So basically, what happens is when you start needing the treatment, if someone comes in, starts requiring treatment, you
Hmm.
do 6 treatments over 3 weeks. That's the
Hmm.
ideal amount. You'll
Hmm.
start feeling improvement after just one treatment. But if you do the six, like over 3 weeks, it works much better. And, I recommend doing of course, the six, although I allow people to pay on demand and pay as you go, just because I want more people to be exposed to it and have some improvement. If you could do 6 treatments, that would be the ideal amount for most men.
Hmm.
After you do 6 treatments, you could either repeat the treatments once every couple of years. A lot of men tend to go on a maintenance therapy where they do one treatment every 2 months,
Hmm.
sometimes every 3 months. Sometimes they repeat a treatment once a year. So everyone, man, is different, and um, it depends on the age, it depends on how fast your erections are degenerating or kind of decreasing.
Hmm.
So there's a lot of different factors that I factor into it, but you know, um, a lot of people react very, very strongly to it, and then it works for 5 to 10 years. Again, everyone's body is so different. Now that since I started doing it in 2017, I have patients who've come in from the original, batch that at 5 years later are like, okay, we need a kind of another
Right.
round. And so that happens quite often. And for the past 5 years, they've been feeling great without any issues. And now Viagra's not working as well, or they started needing Viagra, and then they want to come back to kind of do a booster,
Hmm.
which I do a full 6 treatments again, and I think that works great from almost everyone.
Hmm.
Um, from an efficacy point of view, I know you wanted to, most people want to know about that. I find that 85% of people do well. And what I mean by well is it improves your arteries, veins, and nerves, like I
Hmm.
described. However, erections are 80% mental, so a lot of it is in your head, right?
Hmm.
And that is the part that no urologist can control.
Right.
The interesting thing about Viagra and Cialis, most people don't know, it's a fun fact, is that when it was approved, its efficacy rate was 50%.
Hmm.
And the placebo efficacy rate was 30%.
Right.
So with placebo, it improved 30% of men. With Viagra, obviously, it was a significant improvement. There was almost a doubling in the effectiveness versus a sugar pill. But still, the overall value was only 50, 60% at most.
Right.
And of course, these were sick older men. So you could tell why. I mean, as you get sicker and you have less, like if the last time you had an erection was 5 years ago, it's much harder to get a new erection de novo than if you just Viagra stops working, a couple of weeks
Right.
ago. So I often tell people, like you got to see what stage you're in, and sometimes you need even 2 rounds of shockwave therapy just because your penis was such damaged state at the point when they came into the practice.
Right. So when you're talking about six treatments over 3 weeks, can you describe what's involved with the treatment?
It's a very easy to manage treatment. I haven't had a single patient who stopped the treatments because of pain or discomfort. What I do is I give them like kind of a cream that they put on. That's kind of like a lidocaine based cream. It
Hmm.
penetrates into the skin, stops any kind of pain. And then what ends up happening is you get a numbing effect to the penis for about 6 to 8 hours. Then you do the
Hmm.
shockwave therapy on the penis, and it basically you just it's like a 20, 25-minute treatment where there's sound waves that are kind of applied to various areas of the penis and scrotal area. And that
How,
is,
let me interrupt. How is it applied actually?
so it's applied with there's a handpiece that we use
Okay.
that actually has the shock waves at the end of
Hmm.
it, and
Hmm.
it kind of penetrates through the skin, and it basically hits anything that is not super soft, like your skin is soft. Tends to be that your nerves are much firmer than the skin.
Yeah.
Arteries are much firmer and your veins are much firmer. So it really hits those areas, and it
Hmm.
passes through the connective tissue, which is just basically water. So
Hmm.
it goes through the water, and it kind of gets absorbed by more firm tissue. And
Hmm.
same way that it does with kidney stones, where it passes through your skin, your kidney, and then when it hits the actual stone, which is the hardest thing there, um, it actually cracks it and breaks it up. And so
Hmm.
that's how it has an effect. And we know it works very well on kidney stones, and we know it works well on veins and arteries. Now, it's not one to one, and now it's similar technology, but this is low intensity shockwave therapy, whereas the kidney is more of a higher intensity, which is why
Right.
because we're aiming for kidney stones. Those are kind of like hard rocks,
Hmm.
and the veins and arteries are not hard rocks.
Sure.
So that's why it's lower intensity, because we want to get kind of like little more dense tissue, but not like a kidney stone dense, because there's
Hmm.
various levels of density.
So you're applying this wand up and down the penis for about 20 minutes, and
Mhm.
with that lidocaine or that numbing cream, is the patient feeling anything at all?
They're basically feeling very minimal. They feel some just kind of like tapping on the penis, but it's
Hmm.
not pain in any way. You'd never hear anyone say ouch.
Right.
It's very kind of mild, kind of what I would say is pressure on the penis while it's happening.
Hmm.
And like I said, that was my first thing when I tried it on myself first was,
Hmm.
I thought it was going to be painful, and to my surprise, it was not painful, very comfortable, and I've never really had anyone say, I don't want to continue treatment because of the pain. So
Right.
that's been great. And then also the other thing is, even with the Priapus shot, everyone's worried about like getting a shot in their penis and how that's going to feel.
Right.
But if you have an expert who's done hundreds like I have, I could do
Hmm.
it in my sleep without any pain whatsoever. Most people don't even know that I started or finished.
Right.
when
That's,
when are we going to start? And it's already done, is what most patients tell me, which is surprising to them as well. Like most
hmm.
patients cannot believe that I actually did the 4 injections, without them feeling it. So
Awesome.
I do
Now,
four injections, which is kind of my standard.
what about when the numbing cream wears off 6 to 8 hours later? Is there any expectation of pain or bruising or anything after that in the
So
days following?
I've never had any Yeah, that's a good question. I've never had any bruising. I've never had anyone have pain after the numbing has worn out. Again, the shockwave technology, even when we do it for kidney stones, for example, once they wake up from, say, doing the kidney stone, which is much higher intensity, they don't know that they had anything done. It was just simply during the time while they're doing it. You could feel something while you're doing it. After you're done with it, there's no bruising that happens. I mean, there's really no, thankfully, and again, I've been doing this for over 7 years, and I've never had anyone with like bruising, pain,
Mhm.
or any other complications for that matter, let alone bruising or pain.
Got it. So in terms, you mentioned a little bit about efficacy, and I want to double click on that because I mean, it sounds like this is a pretty, very minimally, not really invasive, I guess. It's a very painless procedure, seems to be working well, and the guys obviously want to know, okay, but let's really get down to brass tacks in terms of how it works, right? So,
Yes.
you had mentioned about 85% efficacy. So the first question I want to have, and again, this is you mentioned efficacy in terms of actually the effects on the vessels. But in terms of patient outcomes, so like three different elements that I was hoping you can address, either from your own experience or just from data out there, maybe from others, in terms of the three elements of the erection, right? Number one, in terms of erection size or the penis size with the erection, does it impact that at all? Number two, rigidity. And number three, how long does it last? Does it affect the time in which you maintain the erection? Could you comment on that in terms of like the efficacy you've seen from that standpoint?
Well, number one, the rigidity, when you improve the arteries, veins, those are the two elements of rigidity, size, and just how long it lasts.
Excuse me.
And just obtaining an erection or getting an erection is usually from the nerves. Maintaining it a little bit from the nerves, but mainly once you get the erection, it's more due to kind of the vascular dynamic patterns that are going on in your penis, because there's one that opens up the blood vessels to get the blood inside.
Hmm.
Then the veins get dilated, and then when the veins are maximally dilated, they actually push on the bigger veins so that there's a lot less drainage of the
Hmm.
penis,
Right.
which you could see in what is called Peyronie's disease, uh,
Hmm.
or so where you can get an erection for extended periods of time and it doesn't go down.
Yeah, the
And
priapism. Uh-huh.
the priapism, I meant, yeah.
Yeah.
So during, when someone has priapism, excuse me, their erection actually doesn't go down because of lack of drainage.
Right.
So blood is getting into the penis, but it's not draining out of the penis. And what
Mm.
we do is we try to actually suck some of the blood out so that the penis gets smaller, and then it allows for drainage of the rest of the blood from the penis. So
Hmm.
that's what I mean by, as you get an erection, you need less and less blood flow into the penis actually to maintain
Hmm.
your erection, because your erection just gets blocked off by the veins. So
Right.
it does improve the rigidity, and the size improves because I feel like it dilates the blood vessels, so it makes them actually appear bigger. So your penis
Hmm.
does appear bigger after you have a shockwave treatment. I mean, most people say that. I mean, and that's kind of how it's working and that it's having an
Hmm.
effect.
Hmm.
The rigidity does improve. The size is not one to one, because you're dilating the vessels. You're not creating new blood vessels. So
Right.
it's not like you're making new blood vessels, and that's with the P shot. You see a lot more of the kind of distending effect and elongating effect, and there's been studies
Hmm.
that show that for every injection with the P shot, you get about 7 millimeters of size with every injection. And
Hmm.
that's how it works. You're taking growth factors from your body. You're taking away the kind of the white blood cells, the red blood cells, all the stuff that creates inflammation, and you're just
Hmm.
putting in the growth factors back into the corpora cavernosum.
Right.
The corpora cavernosum is where you get your actual erections. I mean, no. So it's just the corpora, not it's the so there's so the corpora cavernosum is just the dial. Those are the two tubes that run on the kind of outside of your penis, that when they
Hmm.
get dilated, and they stretch out,
Hmm.
that's where you get your erections. So if you actually put growth factor in it, it actually does have a stimulating effect in terms of growth of blood vessels. And you could actually see that on several studies that keep coming out showing just improvements in size with just doing a P shot. Now, one P shot is very hard to tell a big improvement because it's about 5 to 7 millimeters of growth every time you do a P shot, in my experience. So a millimeter is a very small unit, but it's stackable. So meaning if you do one every 4 to 6 weeks, it could get up to 3 to 3.5 centimeters, which is about an inch to an inch and a half in terms of metric terms.
Right. Now with the shock waves, if you were mentioning again 85% efficacy, like of your patients, what percentage would you say after the shock waves said that, you know what, I've noticed a real significant improvement in erections? Is that the 85% or
That's
how would
exactly
you?
what I mean. Exactly.
Okay.
85. But when I say significant improvement is, I mean, a lot of them already been on Viagra. A lot of them, when they, by the time they kind of do the shockwave treatment, what I've noticed, most people don't do it early on in the process. They do it towards the end of the process.
Right.
And when people do it towards the end of the process, I mean, improvement is all we could hope for at that point. I mean, there's been degeneration in erections, and what we want is, for the Viagra to work better. Most of the time, Viagra hasn't worked as well, or started to kind of go down or not be as reliable. And so now people are like, it's much more reliable. I could rely on Viagra working. So that's a big improvement in my estimation. Again, we're doing a treatment that has really no risk factors, but has a very, I would say, a noticeable effect on erections. The only situations are kind of more difficult for me to deal with are, when there's partner issues, when people aren't attracted to their partner as much.
Sure.
You get older, their attraction to their partner could change. And in those scenarios, Viagra doesn't work well because, again, you can't really, Viagra works once you get an erection, it extends your erection, makes it last longer, makes it firmer, which is why the Viagra stops wearing away. And even shockwave therapy, I mean, you could stimulate your penis, but if it's, if you're not mentally stimulated, it's much harder to get an erection. I mean, you'll get
it's hard to overcome the psychological element. Sure, absolutely.
Correct. And you see that actually when people come in with low testosterone. So the first thing I do is I normalize the testosterone because, if someone has a really low testosterone, no matter what you do on their genitals, it's very difficult to get them to have an erection just because they don't have the sex drive that is required. And so, that's what I meant by 80% of sex is mental. So it starts with the mental desire to want to have sex. And I noticed that some of the people where it doesn't work well are people who the desire is already down.
Right.
Their testosterone is being replaced, but I don't know how well they're taking it or if they're taking it all the time. And so there are other factors involved. Some people have low T and they don't want to be replaced. They just want to get the shockwave therapy. They don't want to have like extra testosterone put into their bodies.
Right.
So it's of course harder to treat patients that are not optimized in other ways, just to make sure their hormone levels are optimized and to make sure that their, partner is optimized and ready for it as well. Because again, it's hard to have sex with a partner who's not motivated to have sex. That's another hurdle that I find often in my patients. And that's very hard to control on my front because, we're not into the psychology of erections. I refer them to sex therapists and things like that. But, that's much the process. And I mean, probably should be done before, but a lot of times, they just want to see if there's a quick fix that can work. I mean, it doesn't harm to try. There's no harm in trying, but, I set realistic expectations just depending on what my consult reveals. If I feel like it's more psychogenic, just that it's not as related to the physical aspect of the penis and the erection, that's when, I try to set expectations and say, look, it's going to be a harder thing. And again, there's other situations like after surgery for prostate removal.
Mm-hmm.
You had your prostate removed and your nerves have been damaged, and maybe even some of the arteries and veins, because when you cut out the prostate, you're actually hitting some of the arteries that go to the penis as well.
Mm-hmm.
So some of the arteries and veins that lead into your penis are damaged. That's when it is also very challenging to get new erections with this technology, because it relies on blood getting there. It
Mm-hmm.
relies on nerves getting to the penis, right?
Right.
If I'm doing shockwave therapy on the penis and the nerves aren't getting there because of
Mm-hmm.
a blockage kind of further up the chain,
Right. Not
it's
going to
very
really help.
difficult. So I really kind of set expectations the right way. In those
Mm-hmm.
patients, I quote it as more 50%.
Mm-hmm.
They probably need 2 shockwave rounds
Mm-hmm.
to kind of give it its maximal try. Because if you can't get an erection with just say shockwave, and we also have what is called trimix, and trimix is where we actually just it's one of the testing that we do on people to make sure that they can actually even get an erection.
Right.
If their trimix test fails, like they're not, after doing an injection of trimix, they still can't really get a good erection. you know I usually try to kind of set their expectations to a lower level, because um, you know the when you're actually giving someone an injection, that should dilate the vessels kind of directly, and if they're
Mm-hmm.
not even getting an erection, um, it could help some patients that can get an erection, but then it goes down very quickly. In which case,
Right.
that may be due to the veins kind of not holding on. It's called
Mm-hmm.
like a venous leak.
Mm-hmm.
Um, and so, I mean, we can do a shockwave therapy and it works in those kind of patients. So it's a very, if someone just coming in and saying, look, Viagra is working great, but now 50% of the time it stopped working, we
Mm-hmm.
know blood flow is getting to the penis, and those are really what we're aiming for in doing the shockwave therapy. And that's really where most of the patients would benefit. When I say most, like that's where it's 90+% get really noticeable effects.
Right. So those are the people who either haven't even tried Viagra because the erectile dysfunction is pretty mild, or they're on Viagra and maybe want an extra boost, but Viagra is still working. Those are the biggest candidates really for the treatment, the most
Yeah,
optimal candidates, right?
right. Those are when you quote 85% and 90, I mean, those are the kind of candidates that will feel it, because they're proven already that they're stimulatable, that they get
Mm-hmm.
stimulation.
Right.
But it's they want that little extra turbo boost.
Right.
And that's the key. I mean, the turbo boost is the thing that gets you through a sexual session without having erectile dysfunction.
Mm-hmm.
And you don't need a lot, but you just need to improve it to the kind of a little bit of the next level,
Mm-hmm.
because nature takes over and is able to maintain your erections. But there are times when you lose a little stimulation and you need to have improved support in your in the vascular tissues.
Right.
So that's really what it comes down to, kind of on a granular level on it. But I feel that as it gets worse, like say it's caused by, let's say erectile dysfunction is caused by Peyronie's disease,
Mm-hmm.
then you need 2 rounds of treatment, and you really have to try to work on the Peyronie's disease itself as well. Like we can kind of break down the Peyronie's disease. So there's it just when there's complexity involved, like surgery in the past, if there's atherosclerotic disease in the rest of the body, let's say someone's had like 5 heart surgeries already, um, you know, um, and I'm just going to clear up one quick misconception with your viewers, because I think
Sure.
everyone's worried that this may affect their heart somehow.
Right.
And the only way erections affect your heart is through exercise. So sexual activity is a lot of exercise, right? And
Mm-hmm.
so in the original Viagra studies, actually, no one um, no one died from the Viagra, or no one had any heart problems from Viagra. They had
Mm-hmm.
heart problems before they took Viagra, and they never, like they weren't climbing stairs, for example, and they were a pretty sedimentary lifestyle. And then what happens is they take Viagra, start having sex. Sex is a lot more work than climbing upstairs, and that's when they
Right.
get the heart attacks because it's just exertion. It's like when you're running down the block for the first time and you're running after someone and then they end up getting a heart attack, is because their heart was bad and then this was just a trigger point.
Mhm.
So I always tell people, if you haven't had your heart checked up and you're pretty sedimentary and you're, a bit overweight, I mean, it's always good to get your heart checked first before you start kind of engaging in sex for the first time. But, the interesting thing is everyone's worried about their heart when they take it. And they always ask me, like, is this going to affect my heart? And I say, actually, it affects your heart in a good way because
Right.
it lowers your pulmonary blood pressure. So if you have
Yeah.
a bit of a blood pressure issue in your pulmonary system, this will lower it. That's what it was invented for. And what they
Right.
found is the guys that were put on it had great erections. And that's how it started as far as an erectile medicine. But
Right.
Viagra was never kind of researched as a erectile medicine until they found that it had this effect in testing for heart problems. So it
Mhm.
actually helped heart problems. It didn't hurt people with heart disease. So, and it doesn't really lower your blood pressure very much by itself, but you have to be careful when you take it with other medicines like nitrites and things like that. So there
Right.
are kind of counter indications to taking it, but those are rare right now. Very few people I see now are on nitrates or nitrites. I think
Mhm.
because of this Viagra effect.
Right. And I think you mentioned this before in terms of how long before guys are going to see an impact on their sexual function once they start the shock waves.
Well, I find that people see a noticeable difference kind of like right away, but the
Hmm.
full effect just keeps, so you'll get like a 10, 15% improvement, then it's 25%, then it's 50%. And as you get towards the sixth treatment, I mean, you find that it really works well, kind of, instead of just like, I feel something, to now like, I definitely feel something and it feels good.
Right.
So, I mean, it feels like an improvement.
And
And
then you're going
people could have sex right after doing the shockwave. I mean, literally within an hour or two, I tell people to wait 6 hours mainly because they have the numbing cream.
to.
So, so you don't
Sure.
want the numbing cream on there while you're trying to have sex because that'll
It's going to be a
lower.
little counterproductive.
Right.
Yeah.
Yeah. So you don't feel, if you don't feel things as well. So I tell
Right.
people wait for the sensation to go back. It's probably maybe 5 to 6 hours, but it's
Hmm.
not a physical problem. It's more of a just, you had the lidocaine cream on there. So it's still going to kind of kick in probably for another 5, 6 hours after they leave the office. So I say, just give it a little time till you get home and, that cream that wears away and then you're ready to go.
And you had mentioned about boosters and stuff like that. So do guys notice a tapering off effect after months or years?
Exactly. So again, when you say guys, there's various age ranges.
Hmm.
When you're doing it in your 20s or 30s, I mean, it could last a lot longer.
Hmm.
As you get older, your arteries, veins, and nerves are already kind of degenerated in some way, and
Hmm.
they actually require boosters in a faster kind of clip.
Got it.
So, a lot of it just depends on the kind of patient, what the history is. A lot of it is also like, what is their hormone levels? Hormone levels are very important.
Hmm.
And that's why people come in a lot afterwards. Just want to make sure their hormone levels are optimized.
Hmm.
A lot of times they come in, it's borderline or, kind of on the low side, and they could be managed better. A lot of primary cares don't really know what the optimal levels of testosterone are or should
Hmm.
be. And so, we have challenges like that where people are coming in and they think their levels are normal. And in
Right.
reality, they're much, closer to castration levels. So,
Yeah.
um, in which case it's very hard to, I treat patients with prostate cancer that they need some kind of castration therapy where you lower their testosterone with
Hmm.
medicine, kind of very low, and almost all of them experience some erectile dysfunction, if not just no desire to have sex and really no um, decreased ability to have sex. So, I try not to put people on kind of extended time frames of the medicine for that reason, because I want to make sure that um, they don't lose their abilities.
Got it. Now, you had mentioned that shockwaves in general are FDA approved. Obviously, kidney stone shockwaves have been around for years and decades, really. But Is the Shockwave of the penis FDA approved, or it's still considered experimental? We had interviewed somebody from the University of Miami, I think a year or two ago, where they were doing some trials. They said it was kind of experimental. What are your thoughts on that?
Well, I think that first of all, people have to understand that before a urologist will completely accept a treatment as a valid treatment, uh, it really does need to go through extensive kind of like say testing, and just to make sure. First of all, the first testing is just to make sure that so like uh, make sure it's safe and effective, right? So
Mhm.
safety is probably more on the initial front. Like you want to determine, okay, is it going to be safe? And we know for a fact it's safe, so that's never really a concern. Now the
Mhm.
question is how effective, is it effective, and how effective is it? And so, really, it's very difficult, like we were talking about with erections, even with Viagra, to show that it was safe and effective. And I mean, it was shown, but with extensive testing before it was kind of put out there to the public.
Mhm.
Um, the thing about Viagra, though, is that it's a medicine, has interactions with other medicines, could cause problems in a lot of, not in a lot of patients, but in some level of the patient population out there.
Mhm.
This really, I really haven't seen any kind of what I would say adverse effects from doing the treatment. So it's safe from one perspective. Also, just as far as the efficacy is concerned, it's been tested much better, of course, for just increasing blood flow to different parts of the body. Like, for
Right.
example, for injured parts of the body, tendons, muscles. I mean, we already know it works very well. It's FDA approved for that. I mean, so
Mhm.
the FDA did approve it for what is called increased vascular, to improve vascularity. And it
Okay.
was a general thing to say improve vascularity. So in some level, it's been approved. I mean, your penis is still part of your body. It still has arteries and veins. And so when we do it on your penis, it does improve the vascularity.
Right.
So it does what it's intended to. There's no
Mhm.
side effects. The
Mhm.
question is, with erections, when 80% of it is mental, and, we want to boost our physical properties to maximize our mental properties.
True.
I think it's a great way to start the treatment, to try it. I mean, I tell people this all the time, because I say, really, if you actually look at what the only risk factor is in the equation, is that it's
Mhm.
typically not covered by insurance, because
My next question.
they call it cosmetic. And the
Uh-huh.
reason they call it cosmetic is because a guy like me can do it when I don't have erectile dysfunction, and I still get good erections.
Right.
Uh, and it just enhances my erections. And
Mhm.
so if you could imagine now, insurance companies are covering it. Now, basically every man is a good candidate for doing it, and
Right.
there's no risks to do it. So that would be a losing equation for insurance companies, because they would literally just be losing money all the time, because every man would want to have a booster treatment. So it's similar to like saying like someone having Botox. Like, do you
Mhm.
really need Botox? And so there's questions there. Some people think you need it to maintain youthfulness and youthful appearance and things like that. But
Right.
insurance companies look at it as cosmetic. So that's what they call it, is cosmetic, and they deny it for that reason. And again, it's because there's really, really low risk, and there's a lot of positive benefit
Mhm.
that doesn't have to be disease specific, although it works
Mhm.
better in disease state.
Right.
Obviously, you'll notice a much better improvement if you're already having like kind of like degraded erections, which is why most men who are on the treatment have degraded erections. It's somewhat degraded erections, so
Right.
that they don't do it when they're perfectly healthy and normal. They tend to do it when there's some level of degradation in their erections.
Got it. Now, given the fact it's not covered by insurance, obviously the next obvious question the guys are going to ask, okay, so how much does it cost? At least on a ballpark level.
So, I mean, what I do is, I try to do it as a per treatment. So, it's $500 per Shockwave session,
Mm-hmm.
and there's 6 sessions.
Mm-hmm.
So, do the math on that. It's $3,000 for,
Mm-hmm.
but I have them pay every time they come in. So the patient would pay like 500 a treatment. Before the treatment, they get the Shockwave, and there would be 6 sessions. So, over the course of the treatments, it would be $3,000.
Got it. Got it.
But
And
if you look at it
finally,
as a long term, like females maintain themselves by, kind of doing their hair, once a month,
mhm,
and that costs $200. So, just by, it's kind of like the way I look at it, it's more of like a guy's maintenance therapy, like
sure.
women do it all the time. And, I think for men to kind of stay relevant and healthy, if they
Listen,
get it, it's relatively inexpensive when you look at like surgical treatment options, such as like say penile implants and
yeah.
Viagra. Up until recently was very similarly priced, but now
Mhm.
thankfully because it's generic, it's gotten a lot lower in terms of pricing.
Yeah, I mean, for my goal, like I said, is that the most important thing is the guys know what they're up against, and if they find that this conversation compelling, that they'll know, okay, approximately this is gonna how much it's gonna cost me. I mean, the plus side, as you've mentioned, is that it doesn't seem to be very risky at all. It doesn't have much in terms of side effects, and has potential upside. So it's just a question for guys to determine, is it worth it to me to try? And based on your experience, sounds like a lot of guys are willing to give it a
Most,
try.
I would think when you're talking about, okay, look, what are the various options on the market, there's really no other option but like Viagra, and then the next level, if Viagra is not working as well, as the penile injections, where you
Mhm.
inject yourself with trimix right before sex every time. And
Right.
so, it's a little more terrifying for most guys. And although it's not really painful and it's very simple to do, and we teach people how to do it all the time, I mean, most guys would rather try something else, especially if they
Mhm.
have the means to have the treatment. So if you
Right.
have the means for the treatment, I think that there's really no other kind of smart or logical way to kind of proceed, in my opinion,
Right.
than shockwave therapy. And if you get the shockwave therapy, like I said, the only thing you're pretty much risking is simply the money that's involved. And again, you're not really risking it in the 80, that's more of like a 15% of the time thing in most
Mhm.
men. Now, of course, as you get more towards the area of where, like post-surgery and Peyronie's disease, or, all these other various factors that we mentioned earlier, basically, that's when you start looking at it as, okay, there's a little more risk involved now, because there's it's not as effective in those patients, no matter how
Mhm.
many treatments you do, because if blood isn't getting to your penis, I mean, physically you can't get an erection unless you
Right.
do a penile implant, in which case I steer people more towards penile implants in those cases. So again, a lot of it is just, in my view, you got to do expectations management.
Mhm.
You got to be honest with the patient, which is what I try to do all the time, and just about in all fields, basically. And the whole key to it is, you know, once people know, I like when people are fully educated and they make their own decisions based on, a high degree of kind of patient education.
Perfect way to sum it up. Dr. Schusterman, thank you very much for your insights and your candor. I'm sure the guys will find it very, very useful. And thank you for joining us. To all you guys out there, thank you for listening and watching and your continued support. And remember our mantra here at Better Man Clinics: use every day to get just a little bit better. We'll see you all next time.